Technology, you gotta love it.
It's the user, not the technology in this situation.
Well, I didn't want to be rude. All you young whippersnappers seem to think you know technology, so that's why I wouldn't want to be rude.
Hey, Yvonne, this is Ashley. We have a quorum, so if you, I believe we're streaming live on YouTube now. So if you want to get started, it's up to you.
Okay, thank you, Pernell, and I just was talking. He'll join us very momentarily. Good afternoon, everyone. I'd like to call to order the Health and Human Services and Aging Committee. Today is Wednesday, July 29th, 2020. Can we have a roll call, please, Madam Clerk?
On the roll, Ms. Conwell,
Present.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown,
Here.
Mr. Miller,
Here.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
And I'd like to make a motion to forgive Ms. Stevens for her meeting absence today. She will not be present. Is there a second?
Second.
All in favor say aye.
Aye.
All right. Madam Clerk, is anyone signed in for public comment today?
No, Madam Chair, no one has submitted any public comment.
All right. We will take care of the approval of the minutes from the July 15th meeting. Can I have a motion and a second, please?
So move.
Move from Brown. Second. Second from Conwell. All in favor say aye.
Aye.
Minutes have been approved for the July 15th meeting. We have nothing referred to our committee today, but we do have a couple of discussions. In light of council being out for 6 weeks, we are having a discussion today from Say Yes to Education, and will consider a first reading suspension on this matter on August 4th. I believe there's Diane Downing and I see Victor Young that will probably present today later on in the discussion. So first, who is up for the housing challenges for children in DCFS custody? There was a newspaper article, I want to say maybe about a month ago, that led for us to find out, for council to hear a little bit about the challenges that the Department of Children and Family Services are having. So who is here to speak to that?
Good morning, or I'm sorry, good afternoon, Madam Chair. David Merriman, Director of the Cuyahoga County Department of Health and Human Services. I'm joined here by staff from the Department of Public Works. They're also available to answer questions about the building space. What we wanted to do today is provide a very brief update on where we stand with the issue and see if there are additional questions. I do want to just recognize that the director, Cindy Weisskettel, unfortunately was unavailable for today. She expressed her interest and her enthusiasm to come and speak to this committee when we have the next step clearly delineated on how we're going to address these problems. What I'd like to do is I'd like to share with you very briefly an overview of where we are and a range of the options that we're beginning to look at. So I think it's very well understood that the county does not look to house youth in our building of any age. That's not what that's not our intention. That's not what our preference. But there are occasions, and they're the majority of the occasions, when an individual, a resident, comes into custody. Frequently this is in the afternoon or it's in the evening, and it takes some time to find a placement. And when that does occur, there are times that young people spend the night in our building. There are also times when young people come into our building for placement and are placed that same day. There are times that young people come into our building for another service, whether they're there with a parent who's engaging in a meeting with DCFS, or they're there for one of the other many services that we provide. And they're asked to stay within a room that is there to meet their needs. And I know that the issue that you want to address today is really, what are we doing to address the youth that are staying in the building for multiple days? And what I'd like to do is just share a little bit of an overview on where we stand within the state, where we stand within the county. And as I said, I'm going to just share a few of the options that we're exploring, and we hope to have an update for you the next HHS committee. So broadly stated, the projection is there'll be 20,000 youth in foster care in Ohio this year. There are something like 7,200 licensed foster care homes for families in Ohio. And simply put, the number of placements do not meet the need and the demand for placement. So there are unfortunate economics at play here, that we have more children than we have placements. To further complicate matters, there has been a significant reduction in the residential placement options that are available to the county's young residents to youth. Many of the residential facilities have gone out of business or have closed their services over the past decade. An example of that would be Parmadale and the resource provided by Catholic Charities. Others have as well. They too are diminished in their capacity, and although there are still wonderful residential placements, we are now in competition for those with other counties. We're other counties from Cuyahoga, from the state of Ohio, but other counties from around the country. And so this has become a competitive environment where we are all trying to secure the limited resources that are available to us in foster homes and residential placements. That is simply where we are in terms of the service, and unfortunately, our efforts to place children are really they have been hampered by COVID. We have to recognize that many of our foster parents have shared the same concerns that all of us share about bringing someone into their house if they have their own children, if they have their own healthcare issues. And so we are worried that, in fact, foster families are reluctant to take children into their house if they don't understand the health needs of those youth and those children. So let me share just a little bit about what we're looking to do, our next steps, so that I can answer any questions. Later this week, we will be engaging all of the major providers from our county, providers that are well known to you and us, that have long-standing working relationships, that have local resources. We'll be meeting with them and asking for their assistance, asking them to take another look at the need and to take another look at what placement and residential options exist for them and for us. These providers have historically played a critical role in our community for meeting the needs of young people. But we are, at times, it appears, losing the competition to place young people with them. And so that's a part of what we're going to look at. If Franklin County pays more than us, and and we need the bed just as much as them, and I think I'd argue maybe more at times, then we're going to have to talk to them about how can they really recognize the unique needs of a resident coming from this county that needs to be placed in this county. That's our preference. That's what we want to do, and that's what we're going to be talking to them this week about. So I hope that this option is the option that we'll be bringing back to this committee to talk to in more detail, and because we know that those providers have the additional resources on site to meet the needs of these young people. I should recognize that we tend to have a harder time placing teens, especially teens with significant barriers. Historically, their organizations like Parmadale were very, very open to taking some of our hardest to serve young people. A tragedy occurred there, and unfortunately Parmadale closed. And that was one of our most significant resources. And so I don't think their role has been filled in our community. But that still doesn't say that the other providers in this community can't meet our needs if we can sit down and work something out with them. So that's the preference. Our preference is to engage our providers to hear how they can partner with us and come back to you with some additional options. The second option that I do want to talk a little bit about is adding on to frankly, the per diem, adding on to what it would, what we pay for these placements. This is something we recognize it's a budget matter. We have our budget. We have a contract in place that includes what the rates are that we will pay for a placement per day. We know other counties have changed their rates, and there have been requests that we change our rates, and so we're going to take another look at that. I'm not going to make a commitment here and now as to what we're going to do with it, because we're still looking at the numbers, looking at some comparisons, and we hope to have a better sense of what would it take for us to be more competitive with other counties. So I would say that's the second option. A third option is there is a really exceptional program that's in the community called 30 Days to Family. This is a service we currently provide, and in essence, it's a very aggressive approach to find individuals from the child's life, generally family members, but not always, that might be available to take a child in need of placement. And the process to investigate these potential placements is lengthy, but we can still start the work. We can be aggressive. We can quickly assess if, in fact, if the young people have someone that would be better suited for a placement than a residential or a foster placement. So that's a third option. Again, this is something we currently do to good effect. We're going to explore if we can ramp it up and do more of it and be more aggressive with it. I do also want to recognize, that we've also talked about using Kinship Care more frequently, and this does connect to 30 Days to Family. They're separate interventions, but clearly there's a continuum here. About 1,000 of our placements, or the children in our custody, our children are placed with family members, and so this is something that we're doing, but we do recognize we could do more of it and we can do a better job. We're also looking at some other alternatives, such as are there other residential resources available in this community that we haven't considered? Aligned systems, residential facilities that could possibly meet our needs. The last that I just would recognize and put on the table is we are also talking about changes to the facility in Jane and Hunter, and needing to respond to both COVID and the call for there to be better social distancing, better management of exposure, but also just taking a second look at what are the code expectations for the building. Is this a time for us to do a refresh of that space? I know that we've done that in the past couple of years, but we've engaged Public Works and one of their providers to begin to scope out what else would we want to do that responds to COVID, responds to the need for both staff and the visitors, young people that are in our building, to give them the space they need to be safe. And if necessary, if they're spending a period of time with us, for them to be able to do so safely and probably with a higher, hopefully a more compassionate care. So I'm going to stop there. And I'd be happy to answer any questions. And as I said, I'm here with Public Works staff are in the room with me as well.
Any questions from the committee?
Madam Chair.
Councilman Miller?
Madam Chair, Director, as you know, we have a December 31st deadline, which hopefully might get extended somewhat, about using CARES Act money. My question is whether there is any plan currently in place for using any of the CARES Act money at the J. Edna Hunter building.
To the councilman, we are looking at an option that does have us make changes to the building. This isn't an option that we've confirmed. Again, I think our preference here is that we would work with our providers, but we do think that we'll want to make some changes to our building to improve it, to be able to address the needs of both the visitors, whether they're there for an hour or unfortunately they're there awaiting placement. We want to make sure they're safe and they've got enough space to social distance. So if that plan comes back and it's something that we agree on and it does help us address COVID, then we would be applying COVID dollars to it.
And Madam Chair, Director, how soon do you intend to have a decision as to whether you're going to go forward with an option in that area?
Well, I think you raised the key point, which is the proposal that the CARES Act extend out. To me, that is difficult to plan around and to make a commitment around. So I don't have a date. I think if in fact the legislation follows and we've got the funding we've got is the funding we have for the next year, then I think we have to take a real hard look at what our plan will be for the next year's needs. So I don't have an answer as to when we'll make that decision. Again, our goal is to talk with our providers, talk with our partners in placement and treatment, to hear from them what their ideas are, and then to make a decision. That decision could be to focus on partnering with them, but also to make some changes to the building. But we want to gather a little bit more information. As I said, I hope when next committee meets, we'll have a clear plan, and we can come back and share with you both what we're going to do and how we're going to fund it.
Madam Chair, Director, how many children in the last year, in the last 12 months, have stayed at the J. Edna Hunter building for more than a day or two?
Councilman Miller, as I sit here, I don't have that number. I can ask Cindy Whiteskettle. I can ask her to run that number. What I would say, I understand there's 100 to 200 kids a month that are changing placement. And so, I don't know what fraction of those spent more than a day or two, but that's something I can ask her to do some research on and come back with an answer.
Madam Chair, Director, how many rooms do we have at the J. Edna Hunter building that are suitable for children to stay for an extended time?
Councilman Miller, we principally use 2 rooms. There's a one room that has more space, and we tend to use for groups of siblings and young adults or older teens. Older teens, we don't have young adults placed with us. And then there's a separate child care room that we frequently use for younger children. But there are times that we might need to use one or both of the rooms for both purposes. So it's principally 2 rooms that are used for this. There's also a room for a shower that has a bathroom in it. And so there's other space that's available for us, but these are the main 2 rooms. And if necessary, if there's a time that we need to take over multi-purpose rooms, we would do that as well. And but the primary space that we use are the 2 rooms.
Madam Chair, Director, at the primary spaces, can more than one child stay there at the same time?
The primary space have enough, they do have enough space that more than one child can be in the room at a time.
Okay, thank you.
I'd just like to share with the committee that I have suggested that Levine Ross be included in discussions regarding the modifications of the children's room and going forward. Is there any update in regards to that, Public Works? Has there been any meeting?
Public Works. I'm sorry, we have Public Works here. There, at this point, what we have are, we're still confirming what the proposal is from Public Works. I think we have a little more work to do before we sit down and make a decision. As I said, the key for us is to first determine what our providers can do to meet our needs. That's the priority, and that's what we're focusing on. And I think once we've completed that, or as we complete that, we'll be focusing more on how we change the room to address COVID. We will invite Levine to a discussion when we have a clear sense of what the plan is.
All right, on another topic, and going forward with discussions with the major providers, is that a meeting that Levine could join in and hear the discussion?
I think at this point it's part of our contract negotiation. So I think that's generally not something we've done, because we have open contracts. Some of them have asked for amendments to their contract, and this is somewhat consistent with that. So I think at this point it would be better for us to to carry that meeting out in the context of doing those negotiations. But let me give that some additional thought. Regardless, I will provide her an update when that meeting ends to let her know how it went.
I just figured, David, in light of the virtual meetings that we have, she's on now, she can hear it firsthand. And so give it some consideration, please, if you don't mind.
Absolutely.
All right, any other questions for Mr. Merriman from council? Is that a hand, Councilwoman Brown? No. All right. Well, me and David have talked about this, that we will come back. We will be out for about 6 weeks. So we're looking at the end of September to have a follow-up from David in regards to what the plan is going forward. Maybe the beginning of October. I'm sure he'll let us know if they have anything definite in place. So we won't just have a brief discussion. And I know that Director Weiskettle will be present for that discussion. So stay tuned for that. Anything else that you'd like to add in light of this, David? Thank you for the presentation.
Yeah, so Councilman Conwell, I will invite Director Weiskettle to our next monthly meeting. So if in the intermeeting period you have questions or she has other updates, she will bring those to that monthly meeting, and you can get a mid-committee update from her directly.
Okay, very good. Thank you. Moving on to our second discussion, as I stated earlier, in light of council taking a 6-week break, we will have to pass this legislation, Say Yes to Education. It has been a pilot program in the works for about a year, so we are all very eager to hear the update today. So who will be leading off first?
Yeah, I could start if it's okay, and then I'm going to turn it over because Diane Downing is going to do the majority of the presentation. But what I'd just like to share on Say Yes to Education. So we've just completed our first year. We're 16 schools and 16 family support specialists were served. I understand there were over or nearly 200,000 referrals on students and their families, some of which had urgent red flags. There have been a range of issues that have been addressed, from mental health to medical assistance to food insecurity. I'll let her speak to the detail on that. I will say that we've done preliminary analysis of the number of young people that are being served by that program that are potentially already known to DCFS. And of the 1,500 or so children that were made known to us, something like 700 plus were already in the child welfare database. So I think we are finding that the Say Yes program is effective in reaching out to children that are engaged in child welfare, either as a voluntary case or as a foster case. And if I can quickly just connect back to the prior presentation, clearly the best way for us to manage the service of young people in the building is to prevent children from coming into custody, from cases to be opened. Maybe I shouldn't say the best, but that's an important strategy, and it's important recognition that we want to stop problems before they intensify and require the county to step in and to intervene. Obviously this is the plan. This is the theory behind our support for Say Yes to Education. DCFS will be analyzing the data for the next period, in essence, February to July, continuing to assess how many of the children served out of Say Yes are known to DCFS. And the second year will consist of an expansion, a real significant expansion that is extremely exciting, adding 42 family support, there will be 42 family support specialists and schools served with that expansion. And I just would tell you that the range of services that are being provided, they are as extensive and as comprehensive as any that we can speak of. Any service that you could probably think of is most likely in the scope. It's a very long list of the types of services that range from referral to food pantries and mental health services to library programs, GED programming, after school activities. It runs the gamut. So with that said, I'd like to turn it over to Diane Downing because she's been operational and managing this program on an ongoing basis. She's here to speak to the program in detail. I would also say that we have Jennifer Crossman on the online here with us. And so if there are additional questions on child welfare, I may be pulling Jennifer into the discussion. So Diane, can I ask you to take it over?
Sure, great. Thanks so much. And thank you, Council Chairperson Conwell and the members of the committee for being here today. We so appreciate your support, your continued support for Say Yes Cleveland. And, you know, as you know, Say Yes Cleveland has two components. One, post-secondary tuition scholarships for graduates of our Cleveland Metropolitan School District high schools, and support services from pre-K through high school graduation that help our students stay on track. And you just heard a little bit about our first year work in that area. So I'm here today. Victor Young, who is the Director of Family and Student Support Services, is here as well to support the legislation for our second year of funding with the county's support for our family support specialists. This funding, there is also funding for our specialists from the Cleveland Metropolitan School District, and this year, Breakthrough Schools, who will have 3 schools in our expanded inventory. So this funding last year that you approved made an immediate impact on our students and their families. And you've heard a little bit about that. We are planning to expand to 26 more schools across Cleveland. We are adding 18 K-8 schools and 8 high schools throughout the city for a total, with our initial first cohort of 16 to 42 schools. By the end of the 2023 school year, we will be in 100% of CMSD schools and our partnering charters. And this is just, as I said, so significant, and Victor will give a little bit more detail, but we want our students, our graduates, to be able to fully access the scholarships that are the promise of Say Yes, full tuition scholarships for our graduates. And in order to be able to do that, even though we've already seen an increase in post-secondary going students from 40 to 49% this year in the first year of Say Yes, we want them to be supported. We want our students to be supported with services from the time they're in preschool through the time they graduate, so they can concentrate on their schoolwork when they're in the classroom and take full advantage of our scholarships after they graduate. With that, I'd like to turn it over to Victor Young. He is, as I said, the Director of Student and Family Services. He works directly with our family support specialists, and he will tell you the progress we've made. And even in during COVID and the way that schools will be reopening in the fall, the great progress that has been made, the important work that's being done, even more important now as we find ourselves in the midst of this pandemic, even more important to support our students and their families. So thank you so much. And Victor, would you like to share your thoughts?
Yes, absolutely. Thank you, Diane. And thank you, Madam Chair and members of the committee for this opportunity to be before you today. I think all of the first cohort family support specialists have joined us today. They're all watching on YouTube, I'm sure, smiling. I've had the pleasure of working closely with this group during the past year, and I can tell you that in partnership with CMSD, the Cuyahoga County support that you provided for the family support specialists has already helped improve the lives of thousands of students, and I am not exaggerating. I think the interventions and the referrals of our family support specialists can be even more important than the immediate benefit of the students in question. And that's because many of those referrals actually help reduce stress on families, thus allowing students to take advantage of school, to grow and to develop, and ultimately take advantage of those scholarships at the end of the rainbow. And to better quantify that impact in this past year, working in only 16 schools, our family support specialists logged notes on their contacts with the students, with over 3,200 of them, making more than 2,000 individual referrals for services and supports. Most of these referrals were either flagged in the Say Yes surveys that were given at the beginning of the year, identified by school-based personnel throughout the year, or self-referred as a result of relationships formed between students and families and the family support specialists. The referrals and issues addressed were usually in the areas of mental health assistance, food challenges and insecurities, medical and legal assistance. Those were the big ones. And during COVID-19 crisis, the work of the family support specialists has actually proven to be even more important. Their roles have actually expanded as we began operating remotely. So in addition to the things I just mentioned as ongoing challenges, they've also worked, the family support specialists have also worked with CMSD to help families overcome a lot of the technological barriers like internet access and access to the devices that they're going to need to connect in this upcoming school year. So I guess in summary, with your continued support, we look forward to adding the 26 more talented, experienced professional on the Say Yes Family Support team. And we're in the final stages of interviewing applicants. I've been working closely with school leadership teams, and our hope is that we can move forward and have them in place helping students and families at the start of the year. So again, thank you very much for this audience. Diane?
Thank you so much. And we're happy to answer any questions from the council.
Yes, I have one, and I don't know if it will be Victor or you, Diane, that answers. In expanding the 26 schools, the current funding does not, that we passed last year, does not accommodate that, yes or no?
Correct. We need to increase the dollars to expand to 42 schools.
Okay, so currently we have 26?
Currently, we have 16. We'd like to add 26 for a total of 42.
Thank you. Any
Madam
questions,
Chair.
Councilman Miller?
Madam Chair, while we're on that aspect, I would start by saying that I strongly support this program and it has the potential to be truly transformative. However, the cost for the coming year, which was just submitted as part of the fiscal agenda for the next council meeting, is, I believe it was like about $2,385,000, and if my memory serves me right, that's higher than the estimates that we were previously given. And my question is whether in fact we've had to increase the estimated cost for the county's participation, and if so, what accounted for that?
Madam Chairman, to the councilman, my information does not reflect an increase. I have been provided, and maybe Mr. Merriman can confirm, but we are tracking to the rollout that was provided during the planning phase of Say Yes. So it's just the increment to support 42 family support specialists as opposed to 16. So I don't
Yeah.
know of any change in that progression.
Okay.
Yeah, that's accurate. I've reviewed what was developed by Walter Parfiowicz in 2018. I think when they projected this out, they projected over the 4 years, the county's commitment would change as the program extended, and this is consistent with those projections. There's not a change.
Okay, thank you. Second question is that I know that Cuyahoga County is also supporting a closing the achievement gap program within the Cleveland Public Schools. And my question is what the relationship is between that program and the work being done by the support specialists, and is there an overlap, or are they dealing with different things? Perhaps because the closing the achievement gap is fairly young. It's at the 9th grade level primarily. So could you comment about that?
Yes, so I think it's a great question. It is something that we are talking about. I've had conversations with both Robin Martin from Family and Children First Council, that is the manager of the Closing the Achievement Gap, or CTAG program. Robin and I are talking about changes and opportunities to improve that program. But we've also talked about how we could better integrate it with Say Yes to Education. As you recognize, there is a clear link in terms of the county's role of supporting education. Education is not principal responsibility of the county, but much of what we do does support the environment as well as the outside programs that facilitate education. And so Robin and I have talked about this. Director Cindy Weiss-Kettle and I have also talked about it. We don't have a proposal for you right now, but you should know that we are talking and we are planning to see, as we consider how to improve CTAG, we will be looking at how we can integrate it with other programs such as Say Yes. It's a very good question. We are working on it.
Thank you. And my final question is to Mr. Young. And I would just like if you could describe for me what the typical background experience and education is of the highest quality applicants that you're getting for the for being the support specialists.
Oh my gosh. Well, of the highest quality. Well, I'll start with
The highest quality are the typical ones that are the ones that you would choose.
Yes.
The
So-
ones that you would hire.
Absolutely.
What
So-
do the people that you hire typically look like?
Yes, it's a very, very deep bench. It's a very good question. The typical person has a master's degree in either social work or counseling. We do have a few people who are either in PhD programs or have PhDs already, and at least 5 years field experience working in some sort of in a support capacity with young children or high school children and families, either through social services or children's services experiences or mental health. But I'd say the average academic preparation is a master's degree in social work. And about half of them are also clinically licensed. Not that we're asking them to provide that service, but they have that background.
And what's the typical starting pay level?
67.5 plus benefits.
Okay, thank you.
You're welcome.
Any other questions from my colleagues?
Madam Chair,
Councilman Jones?
with the Say Yes to Education, and forgive me if it's already been asked, but I'd like to know how many children actually receive scholarships for the upcoming year.
Madam Chairman, to the councilman, for the 2019 graduating class, we provided 845 graduates with Say Yes scholarships.
845. How
Right.
many actually graduated? In other words, is there a difference between the graduation and the number of children who actually got scholarships?
Yes, the class size for the class of 2019 was about 2,300 students. But this was our first year of Say Yes scholarships.
Okay, so how would you qualify that? Is it 845 because there was insufficient funds for everyone, or help me qualify 845 as opposed to 2,300 getting scholarships?
Right, so it did, this number actually was an increase over the prior 3 years of post-secondary enrollment for our graduates. So the 3 years before Say Yes came to Cleveland, we sent about 40% of CMSD graduates to post-secondary education, or 40% enrolled. This year, in the first year, with Say Yes scholarships available, 49% of the class of 2019 enrolled in post-secondary education. So already an increase, a significant increase in the number of students taking advantage of post-secondary programs. And this is not just a 4-year school, it's also 2-year schools and accredited trade programs. And I will say we have raised $93 million for scholarships for Say Yes students, Say Yes qualified students. And so the program is there for everyone who wants to take advantage of it. We have enough funding.
Excellent. So 49%, in other words, half of the 2,300 enrolled, is that 1,000, 1,150, something like that?
Actually, not every one of our graduates lives in the CMSD school district. And in order to be a Say Yes scholar, you have to live within the Cleveland Metropolitan School District. So of those who were eligible and lived in the district, we actually sent 845 graduates to post-secondary education.
Oh, what was the eligible number of students?
I don't have that.
Can I say one point on that though? So I do want to recognize that the county has been engaged by the CMSD and a community of providers that's focusing on young people that don't go to college and are largely looking at what we're planning around is a number like 1,000, up to 1,000 individuals that don't go on to Say Yes. What sort of workforce service referral and engagement can we offer them? So I would say the counterfactual, if you will, is, up to 1,000 individuals graduating from the CMSD, we may want to expose them to the sector partnerships and the other programs that are available in our community, because we know that some of those students and some of those graduates are in fact not planning to go straight to college.
So Dave, let me say this is an incredible program. I've been excited about it from day one when I first heard about it and the monies were being raised. 845 students is impressive in and of itself, that we've given monies to help 845 students go to college. I guess all I'm doing is teasing around the edges, trying to understand, how all things can be improved and how we're moving forward. If there were 2,300, I was going to use the word eligible, but 2,300 students graduating, and we've gotten 845. Have we maxed out? Have we reached where we want to be? And do we have an understanding of it? And if not, what is the understanding of the other 700, 800, whatever that difference is? It looks like 1,200 plus students. What is their situation? Are they going to college on their own? Are they not eligible? Are they whatever? What is the circumstance around those the difference between 845 and 2300?
So, Madam Chairwoman, to the councilman, this was the first year of Say Yes. So our hope, what we've seen in other Say Yes cities is as the program continues and as we expand the support services through our family support specialists in schools and connect students with services so that when they're in the classroom, they can concentrate on their academics. We hope, we believe that we will see that number increase. So 845 was a nice beginning, but what we're looking to do is to increase that number every year throughout the 25 years that Say Yes scholarships will be available to CMSD students.
All right.
Can I just add to that, Councilman, you asked the question, what can we do? I think one of the things we're doing is we're doing it today. You know, I think this has been a year where we've all made a lot of adjustments in our schedule. Unfortunately, you know, it is not routine for us to come to council and ask for a passage of an item on first reading suspension of rules. We do that very, very cautiously. But you know, the success of this program this first year is exceptional. And the proposal to expand services from 15% of school sites to 40% of school sites is a very significant increase. I think we're doing that. I think we're adding resources with the clear intent of increasing the supportive services offered to those students. And I believe that that is one of the things that will help us expand and continue what was really an outstanding first year to an even better second year. The investment that we're making in this and the request that we have this item before the council for first reading suspension, I think is one way in which we're clearly endorsing moving forward.
Great. And my last question is, what was CMSD's graduation rate for this year?
Councilman, I do not have that number, but I can get it to you. I can send that to you.
That is fine. I would like to know.
Well,
Thank
and Councilman, through the chair, I actually believe that it was just under 69%.
9%.
which
So
is
there were
higher.
2,300 graduating students, and that was just under 69% of the entire, I guess, 12th grade class.
I'm not sure of how they calculated it, but that's the number that they use.
Okay, well, I appreciate that.
Welcome.
Thank you, Madam Chair.
You're welcome. I have a couple questions. Does the post-secondary program participants receive full scholarships?
Madam Chairwoman, they receive full tuition scholarships. Say Yes does not provide scholarships or funding for room and board.
Okay, but for 4 years or 2 years, depending on the program that they're in.
Yes, that's correct.
Okay, and second question, it might be related to Councilman Jones. Out of the 845 scholarships given, what is the status of those students now? So last year was the first year that we gave it out. So they went to college during this COVID year. Am I following that correctly?
Yes.
Okay, so how are we tracking their progress in terms of, you know, and I know different schools were doing different things, so I don't know how it impacted them this year.
So we are right now, and I can send to you, doing an analysis with help from College Now of how each of our scholarship recipients did during their first year in post-secondary education. So that is being finalized for the class of 2019. As soon as colleges and other post-secondary programs shut down in March, College Now reached out through their mentors and also to their contacts at each college and university. We reached out to the students there to find out how they were going to deal with the shutdown of colleges and universities? Did they have what they needed to continue their work offsite now that the campuses were closed? Did they have the technology they needed? Did they have the supports they needed? And when we identified a need, when College Now identified a need, they filled it, whether it was for a laptop or support for the family as students returned to Cleveland from their college or university. So that was very intense work for every single Say Yes scholarship recipient. And it was ongoing through the end of the semester in May.
All right, another question, is the $93 million currently earning interest?
Yes, Madam Chair, it is earning interest. It is invested through the Cleveland Foundation investment programs. And I don't have the current update, but it is invested.
All right, so I'm just looking over the authorized amendment. So I just want the committee to be clear, as well as myself. So we are extending the time period for this, and we're also adding in the breakthrough public schools.
3 breakthrough campuses. Yes, Madam Chairwoman.
Any other questions, Councilwoman Brown?
Thank you. I was just curious, we just vetted legislation for the digital divide, the $1.5 million to help K through 12 students get access to Wi-Fi. Is Say Yes a part of that Digital Equity Commission or committee?
We work closely with CMSD and Breakthrough. Our family support specialists have been very important in getting technology distributed to CMSD students, but we are not officially part of the committee.
Okay, so with the closing of schools, it just seems like a very very well-made match, if you know, for lack of a better expression, for you guys to kind of work collaboratively on this, especially if the idea is to help those who are in need of these services have access to them. So I'm not sure how we connect the two, but if you're comfortable working through CMSD, then I guess that will suffice. But I know Say Yes is focused in Cleveland, and the Digital Equity Commission is focused on Cleveland as well as the entering suburbs. But I think the computer component has value that seems like it would be helpful to Say Yes also.
Yes, Councilwoman, and actually I do realize I have a meeting scheduled with representatives from the Cleveland Foundation, CMSD, and the Gund Foundation on that very topic scheduled for next week. So I think that's another way, that's the way Say Yes will have entree.
Okay, thank you. I'm glad to hear that. Thank you, Madam Chair.
That's a good point and good suggestion, Councilwoman Brown. So if Diane could keep us updated on that. We like to see the funds leveraged. That was a good point. Any other questions from my colleagues?
Madam Chair, just want to reemphasize, if I could get the graduation rate, the actual graduation rate numbers for Cleveland.
Councilman, I've made a note of it and I will send that to you.
I appreciate it. Thank you.
Mm-hmm.
All right, before we wrap up, if there are any other further questions from any my colleagues that were able to attend today or not attend, or just colleagues in general, before the vote on next Tuesday, who could we reach out to?
Councilwoman Conwell, we will be on camera. We will be available for that meeting. You can reach out to me prior to that meeting if there are other questions. I will work with Diane and her team to get you answers, but I'll also invite Diane and the team to be available for Tuesday's meeting. so that if anyone has a question at that time, we can also step up and answer then.
Okay, thank you. Because it's a lot to process, and we probably just got the amendment, so everyone probably hasn't had a chance to fully digest everything that's in the amendment. Any other final questions? All right, well, I'd like to thank everybody for their time and attention today to these very important topics involving our children of this county. I would like to move and ask if there's any miscellaneous business from any of my colleagues that they would like to share. All right, hearing none.
Councilwoman, can I just say thank you very much for considering to say yes today. Again, this isn't something we do casually, and we're very grateful for your even consideration of the presentation today and the consideration of this item for first reading suspension on Tuesday. Thank you very much for that.
Okay, you're welcome.
Thank
So, anything else? This meeting is adjourned. Thank you, everyone.
Thank you.
Thank you.
Thank you.